Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit ipro.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions here at IPRO. In today's episode, we'll cover the growing role of artificial intelligence in healthcare, resources to support vaccination against common respiratory viruses, and in recognition of IPRO's 40th anniversary, we'll take a look back at how healthcare quality improvement has evolved over the past 4 decades. But first, a few quick headlines and updates from around the nation and here at IPRO. Artificial intelligence, or AI for short, is infiltrating every sector of society, including healthcare. A February report in Health Leaders Media noted that the White House and various federal agencies are trying to develop rules around the use of AI. One of the challenges they face is trying to keep up with technology that is evolving at such a rapid pace. Venture capitalists have invested an estimated $28 billion into digital health firms that specialize in artificial intelligence, according to the Health Leaders article. IPRO is keeping a close eye on AI developments, including integrating AI and machine learning into aspects of the work we do. Health Policy News Agency, KFF, has launched its Health Misinformation Monitor, a project that tracks health misinformation in the U.S. and analyzes its impact on Americans. Its latest poll shows 2/3 of Americans have used AI. More than half of those surveyed admitted that they are not confident that they can tell the difference between what is true and what is false when it comes to information they get from AI and chatbots. And with flu season right around the corner, we are already seeing an uptick in respiratory viruses, including COVID-19, both in the community and in congregate care settings such as nursing homes and other long-term care facilities. The IPRO QuinnQIO has launched a microsite for providers that features tools and resources that support vaccination efforts against the most prevalent respiratory viruses, influenza, RSV, and COVID-19. The site is part of a campaign known as WAVE, which reminds providers to ask, "What about vaccines?" every time. You can even download an animated video in English or Spanish to educate the public about the pneumococcal vaccine. Visit qi.ipro.org and click on the WAVE campaign button for more information. This year, IPRO marks its 40th anniversary. The company started as a New York State Medicaid contractor in 1984, the year the first Apple computer debuted. By 1989, IPRO had secured its first Medicare contract, and by 1997, the company had a national footprint with independent review organization contracts. Over the past 4 decades, IPRO has evolved into a national leader in healthcare quality improvement with close to 350 employees, an equal number of professional consultants, and more than 100 contracts across over 30 states and the District of Columbia. Joining us today is IPRO's founder and CEO, Ted Will. Thanks for speaking with us today, Ted.
Thanks for the invite, Eddie. Glad to be here.
Well, thanks, Ted. Let's get started then. IPRO's history is a bit interesting because over the past 40 years, it's had to pivot a number of times to meet changing regulations, adapt to new technologies, and keep pace with emerging clinical issues. How much of this could you have foreseen in the early years of the organization?
Well, there is no question 40 years is a long period of time. And I think, we've been very fortunate in terms of our ability to sort of look around the corner and look over the mountaintop and get a view of what we see coming down the road. I will say basically, although how we do our work has changed, our basic mission has never really changed. We continue to focus on improving the quality of care for all Americans.
Great. That makes sense. So can you tell us a little bit of the kind of work IPRO does with its federal clients?
Sure. So as many people may know, most of IPRO's work come through either federal or state customers. And as you hear, we have a very broad footprint. And again, although each of the contracts are different in the sense that everybody has its own set of deliverables and is very specific on how the work to get done, for the most part, the work that we do all aligns with one another. Again, improving quality of care. Most of our work comes through what is known as a request for proposal. The government will issue an RFP, and then they'll have competitive bids, evaluate both the technical and the cost component of the contract, and make an award. Now, we've been very fortunate because we've done very well through that RFP process, and we are able to build upon our current work in terms of capturing new work.
Okay, good to know. Well, how important, Ted, considering all that, are the hiring decisions for a company like IPRO engaged in this healthcare quality improvement type of work?
Well, as a service company, we rely very heavily on our staff. We don't make widgets. We don't have factories. All of our work is staff driven. So clearly, making the correct hiring decision is very important because that is ultimately how we meet our customers' needs. So recruitment, retention, and motivation of staff is very high on what we do every day. And we've been very fortunate to develop a very strong team, a very loyal team, and a very highly talented team. And that's a large part of our success.
Well, that's really great. So personally, what's been the most rewarding aspect of the work that IPRO's done as you've, sat at the helm of it for 40 years now?
Well, I do enjoy coming to work every day. I mean, the work we do is mission driven. As I mentioned earlier, improving quality of care is important work. And I also enjoy working with the staff and the board in accomplishing that work. So I don't know that there's one important aspect of it, but I do feel very fortunate to do work that's both enjoyable, important, and results in better life for folks around the country.
All right. Thank you, Ted, for that. Looking forward a little bit, I guess, what do you foresee as the challenges or changes that the organization will face over the next few years and really will drive whether or not its success will continue?
So once again, we're trying to look around the corner. We're trying to look over the mountaintop. And a lot of the way we do our work and the type of work we do sort of parallels with the changes to the healthcare system. So healthcare continues to evolve, continues to change. And I think one of our biggest challenges will be our ability to continue to change, to innovate, and to provide new services that the customers desire. One of the things we've all talked about is the role that AI might have in our work, as it will have in healthcare. There's a lot of new ideas of how that may revolutionize the way healthcare is delivered. And clearly, as the healthcare delivery system changes, IPRO's work will change.
That makes a lot of sense. I mean, there's a lot of unknowns and a lot of opportunity, obviously, ahead of the organization. So, Ted, IPRO seems to have its hands in a lot of different types of work. Could you sort of walk us through a few examples of the variety that IPRO is involved in?
Sure. So, as we discussed, most of IPRO's work is driven by federal and state contracts. And like every contract, they have specific requirements of the work we perform every day. So on the federal side, we do QIO work, we do hospital work, we do ESRD work. On the state side, we do Medicaid utilization review, we do EQRO, we do external appeals. But as part of those federal and state contracts, very often we get involved with special projects, which very often are very timely and very interesting work. So iPro was recently very involved with the COVID pandemic in nursing homes. And we were required to go out and help nursing homes with vaccinations, infection controls, and other activities related to the COVID pandemic. We also were involved with the 9/11 emergency, and we established a consumer hotline here at iPro in 24 hours to help Medicare beneficiaries guide them through the healthcare system during the 9/11 emergency. We were also involved with the Ebola emergency, and we're actually screening patients or potential patients, or I should say folks coming off the planes at Kennedy Airport who may be at risk. Not only do our contracts require day-to-day operation, but they give us the flexibility to become involved with a lot of very timely, important public health issues.
Wow, that's quite a list, Ted. I mean, it really speaks to, the type of folks and the type of organization iPro is. Speaking of which, I did have one other question for you, which is, the organization has steadily grown over the past 40 years and, is recognized as a national leader. And as a nonprofit, you don't often see nonprofits sticking around for 40 years. What would you say is sort of the secret sauce, I guess, behind iPro's success, if you had to sort of put it in a few words?
Yeah, I don't know that I could sort of identify the secret sauce so much as to say we are a nonprofit mission-driven organization. I think clearly it creates the ability for staff to feel really good about their work every day. And I will attribute iPro's success to the team we were able to build and continue to build over the last 40 years. I think the one thing we're going to have to start thinking about now as we hit that 40th anniversary mark is succession planning. A lot of our key leaders now are thinking about retirement as that 40-year mark quickly approaches. And it'll be important for iPro to have a great succession plan to continue its work into the future.
Thank you, Ted. So, Ted, I know a lot of iPro's success really comes as a product of its people. And I think you've sort of pointed that out a few times. Could you really talk to our audience a little bit about the type of individuals that find themselves working here at iPro and maybe how that's changed from when the organization began to, 40 years later?
Sure, Eddie. So as we've talked about, the work of the company has changed over the last 40 years. When we first started out, we did lots and lots of case review, lots and lots of medical records review. And that work now has shifted to a much different population health focus and working directly with providers and collaborators to improve quality of care. And as a result, the type of people we have on staff has changed. But I will say the one thing that hasn't changed is our very heavy focus on clinical staff that can really provide insight into the healthcare system. We obviously employ lots of other people to support that clinical focus, but I will say one of the big strengths of the organization is its very strong clinical staff.
Well, thanks, Ted. It's clear that iPro's success, as you mentioned, is highly dependent upon its clinical backbone. How do you see that, if at all, changing moving forward with the new type of work that the organization is pursuing?
Well, clearly, Eddie, data is going to continue to play a larger role in the work we do. In the beginning, we relied on manual medical records and we used to abstract information. But now with the advent of electronic health records, clearly we'll have available much more timely and accurate information regarding care being delivered. And our ability to use that data effectively will be critical to our success. So what we're working on now are new ways to collect clinical information electronically to use that data in a positive way.
On this 40th anniversary year, Ted, what's your grander message for both iPro's clients and staff, as they look forward to hopefully another 40 years worth of success?
Well, clearly, meeting the needs of the customers always going to be important, right? Because you want them to have the trust to contract with you. So clearly, it's a big thank you to our current clients for having the trust to contract with us to provide those services. And it's a big thank you to the staff for their efforts to making sure we meet those customer needs. Every year, we do partake in employee satisfaction, customer satisfaction, and client satisfaction. And all those metrics are very high. I mean, we have a great ability to do those things, and we want to continue to do those into the future.
Well, thank you, Ted. I mean, this has really been something. I appreciate the time you've spent here with us, really sort of walking us through what those 40 years have looked like and really giving us an eye towards what it will look like maybe moving forward. So for folks who are listening, if you want to learn more about iPro's 40-year history and the organization's current work, please feel free to check out the website at ipro.org. That's IPRO.org. And or in the Quality Watch show notes. It's time for us to crunch some numbers in our Data Watch portion of the program. As we celebrate iPro's 40th anniversary, here are a few data points about the company. iPro currently has a staff of 362 full-time employees, plus more than 475 physician consultants. iPro conducts its work across 32 states and the District of Columbia. In addition to its Lake Success headquarters, iPro maintains offices in Albany, New York, Hamilton, New Jersey, and Beechwood, Ohio. The organization's work has achieved impressive results. For example, as a Quality Innovation Network Quality Improvement Organization, or QuinQIO, our targeted COVID-19 vaccination campaigns helped avoid 13,565 hospitalizations of nursing home residents, resulting in over $300 million in Medicare Part A savings. Care coordination initiatives under our QuinQIO contract have resulted in over 750,000 fewer hospital events for nursing home residents, saving the Medicare system close to $5.76 billion. That's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of iPro, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. If you've enjoyed this podcast, please feel free to leave us a comment and subscribe wherever you listen to podcasts. We will be back next month with more. Until then, we'll be working on better healthcare realized.